welcome back, everybody. If you or someone you know suffers from the pain of uterine fibroids, you really need to hear this information because treating them effectively has never been better, especially here at Windsong Radiology. My guest this morning is Dr. Dana Dunleavy, who is the Director of Interventional Radiology. Let's talk about this new treatment for uterine fibroids. And doctor, it's nice to have you here.
Thank you so much. And yes, there are many options for fibroids, starting with doing nothing. Just because we have them, they are non-cancerous growths, and you don't necessarily have to do anything, but it's good to know all of your options.
If you have painful fibroids, many women in the past have been advised to have a hysterectomy or another type of surgery called a myomectomy, but there's another wonderful third choice.
Correct. And so both of those are surgical options and are very appropriate in the right setting. And a non-surgical option, which allows you to retain your uterus, is called uterine artery embolization, or some people call it uterine fibroid embolization. And essentially, you just cut off the blood supply to the benign mass, so basically a non-cancerous growth causing those symptoms, and it shrinks away.
That's amazing. How long is this treatment?
The treatment takes about half hour. Here for a few hours, basically because we get you ready, access the artery, do the procedure, and then you hang out with us just to make sure you're comfortable before you go home.
And is that the only treatment, or do you need to come back?
That is the only treatment. So this is a one-and-done procedure. If there were any reason to repeat it, you could, but we never have any intentions of doing that.
That is amazing, especially if you know what is involved with a myomectomy. It can be a very serious operation, very long, drawn out, very long recovery. Recovery sounds pretty good for this.
This is great, and it is of a lot of interest to people that are working and might be training for a marathon, or they just like going to the gym. Essentially, it's something where you could come, you go right home the same day, so there's no hospitalization, and most people take that week off but go back to work the next week. Dr.
Dunleavy, what if someone is in childbearing age and they've had these fibroids? Is this a good treatment for them?
Well, we do. It's a little bit of a complex decision for every one of these options if you're interested in fertility. Even having fibroids does reduce your fertility. And so we try to obviously avoid surgery when possible, but we work very closely with the gynecologist to discuss the differences between uterine fibroid embolization and myomectomy. And depending on the fibroids, one or the other could be the best option.
And that was my next question. Should a woman's gynecologist refer her to you?
Ideally, yes. We work with all the physicians and patients directly, but we really try to do this as a collaborative effort with the gynecologist. It's not something that is competitive. It's really something that we are trying to do the best for the patient and for the gynecologist, and we have a tool that can be very helpful.
You know, doctor, every time I come to Windsong and talk to you, whether it's about varicose veins or uterine fibroid embolization, I'm amazed at what you're doing these days. I mean, this is amazing. So many people suffered for so long with things like this. And now here, if you come to Windsong, you can have this taken care of in 1 or 2 visits, and you can move on with your life.
Yes, thank you for bringing it up. And this is just an effort to improve awareness. We want people to know all of their options, not push any single one, for them. But you can see with all of this brand new equipment and the new facility is ideally suited essentially for the collaboration we have with gynecologists and as a women's health center.
Well, thank you so much for talking with us today. Dr. Dana Dunleavy here at Windsong Radiology. Please don't suffer anymore from fibroids or varicose veins when there's such great treatment available. Why don't you call or log on to Windsong Radiology today?